All right, let's reconvene after our break. Our next presentation is Risk Less, Do More, an overview of the new evidence-based campaign from HHS to prevent respiratory illness. Our presenter is May Malik from the U.S. Department of Health and Human Services. May Malik is the Deputy Assistant Secretary for Public Affairs for Public Education at HHS. She'll provide an overview of the new HHS pan-respiratory campaign called Risk Less, Do More. Ms. Malik, I see you on the
Yes.
screen. You have the floor.
Good morning. Thank you so much. I hope everyone can hear me okay. Thank you for having me join you all to talk about this new campaign. It's always a pleasure to speak to this group, truly. Next slide, please. And next slide. Thank you. So on August 19th, I think many of you have already gotten a little familiar with the Risk Less, Do More campaign. On August 19th, we launched the Risk Less, Do More campaign. It's a national effort to increase awareness of, confidence in, and uptake of vaccines that reduce severe illness from COVID, flu, and RSV. The campaign will deliver research-based messages promoting vaccination through paid, earned, and owned media, including TV, radio, print, social, digital, and out-of-home advertising, to help limit the spread of these viruses populations. The campaign is also partnering with national, state, and local organizations, medical provider groups, and pharmacy groups, and universities to ensure that we're really reaching people where they are and equipping them with the information that they need to protect themselves and their loved ones against this season's most prevalent viruses. Next slide, please. The campaign has a number of goals. Our goals are to increase vaccination uptake, increase public trust in vaccines. As many of you know, we ran the We Can Do This campaign for a number of years at the height of the public health emergency. It sunsetted in the spring of last year with the end of the public health emergency. And so there's been a vacuum, right? There hasn't been consistent, steady, nationwide COVID-19 messaging. And so we need to re-educate people about the efficacy and safety and ensure that we're increasing their trust in these vaccines. Our third goal is to cultivate vaccine literacy. And then finally, we want to enhance awareness of vaccine accessibility. We want people to know that they're available and point folks to HHS.gov for the fall and winter. The campaign actually includes two stages. I'll go into it in a little bit. We're in the cultivate confidence stage at the moment. The two stages are designed to address knowledge and behavior-based goals. The ads that launched on August 19th are part of our cultivate confidence stage. And the ads that are rolling out this month and in November are part of our motivate action stage. And I'll explain the difference in a second. Next slide, please. And just a little bit about our audiences. We have a number of them. So unlike past campaigns, right at the height of the public health emergency, our goal is to get everybody vaccinated who is eligible, right, for the vaccine. This time we're speaking about 3 different vaccines and 3 different viruses and a number of different vulnerable and critical groups. Our primary audiences are older adults 65 plus, because these are the folks who are most at risk of severe outcomes, long-term care facilities, including older adults and people with disabilities, and health navigators, who are those folks, you know, as we know, I'm a health navigator myself. I'm sure many of you in the Zoom room and in person can understand the folks that are there to help make healthcare decisions for those primary older audiences. And these primary audiences, again, were carefully selected because it's among these populations where we stand to save the most lives, because they are the most at risk of severe outcomes if they were to contract one or more of these viruses. and older adults and long-term care facility residents are most vulnerable, right, to these severe outcomes, including hospitalization and death, and healthcare navigators are often our entryway in. Our secondary audiences are pregnant people, adults in historically marginalized communities, including Black, Latino, and rural audiences, and healthcare providers, because if any of you saw my last talk at the last gathering of the NVAC, I talked a lot about trusted messengers and how one big takeaway from our We Can Do This campaign was that people trust their doctors the most, and that we have to mobilize healthcare providers to serve as trusted, credible messengers in their community. And so as part of this campaign, we did something a little different. We engaged healthcare providers at the ideation and conceptualization phase to understand their insights, what they perceive to be were barriers to vaccine access, and also to understand from them what would help them do their work in terms of facilitating conversations around vaccine administration with their patients and encouraging and motivating action around vaccines. And so, we took that learning. We know that primary care physicians are the folks that our audiences trust the most. And so they are actually, in addition to that, a key audience. We have ads that speak directly to them, and a ton of resources that are designed to cater to them specifically. Next slide, please. So about our approach, we are implementing the campaign into 2 stages. We are in the cultivate confidence stage right now. What I mean by that is in initial sort of external research that we did as part of this campaign, we had to pull this together very quickly. It became very clear that among our priority audiences, there was a significant low level of awareness and understanding of RSV and RSV vaccines. And so on August 19th, the suite of ads that we launched are digital and social only and focus on RSV, because it is our attempt to cultivate confidence, right, in RSV vaccines, and to re-educate and educate people about the seriousness, right, the potential seriousness of RSV for some of these target groups, for older adults or those with chronic or underlying health conditions. And RSV recently came to market, and so there's just understandably a lower awareness of the vaccine. But as the 2024-2025 flu and COVID vaccines become more widely available, the campaign will then aim to motivate audiences. So hence our motivate action advertising, to be sure that they're up to date with all 3 vaccines as appropriate. And that advertising, in fact, our first wave of motivate action advertising launches next week. And I'll go into that a little bit more. Next slide, please. And to whomever is handling this presentation for me, thank you kindly. Just a little bit about the messages. The campaign's brand, Risk Less, Do More, emphasizes that some people live with a greater risk of severe illness or death from respiratory viruses, but getting this season's vaccines reduces the risk so they can continue doing the things that they love. Risk Less, Do More uses uplifting, relatable, and unexpected messages to reach at-risk people and connect preventive steps, such as vaccines, to meaningful moments in our lives. Next slide, please. And this is just a high-level look at the timeline. As you can see, we have our ads running on through January that are focused on RSV. The ads are accompanied by earned media coverage and healthcare provider engagements. We last month started our initial execution of partner activities. We launched our campaign website called risklessdomore.hhs.gov. Highly encourage you to take a look. In September to October, we're launching the first wave of Motivate Action messaging via TV, radio, social, digital, print, out of home, to encourage priority audiences to get these vaccines before respiratory virus season, and it's to get flu and COVID vaccines. This will also be accompanied by earned media coverage, healthcare provider engagement, and partnership activations. And there will be a continued distribution of resources for healthcare providers via the campaign website, as well as listserv emails. This will all occur at the same time. Many of you in the virtual and in-person room have received these represent a group or an entity that hasn't, please reach out to me after this, because we want to make sure that you are in touch and get these resources. From September through December, we're going to be executing the majority of our partnership activities focused on older adults and other vulnerable groups. And these partnership activities range from virtual webinars to in-person community events to actual pop-up clinics inside long-term care facilities. So it's a range of events. For example, right now we are doing some pop-up clinic activations, but primarily awareness building activations with historically Black colleges and universities as part of their sports homecoming series. It's called the Tailgate Wellness Tour. So if any of you are big college football fans, you might see that, or whatever sport is in season at the moment, forgive me. And then in November, we're going to launch our second wave of Motivate Action advertising, leading into the colder months and holiday season as people begin to gather. And then we continue our healthcare provider engagements via partnerships, earned media, resource distribution, et cetera. So that's just a high level overview. Next slide. Next slide. And I just wanted you all to take a quick look at the ads that we just released. These are the ones focused on adults 60 plus, focused on RSV. I love these ads. I love the feel. They're more uplifting, but also, there's both a gain and a loss frame, right? That yes, you are at greater risk because of age. Age is a risk factor. And or because you have an underlying chronic condition or two, but that there is a real preventive measure. There is a real measure to protect you from severe illness, and that's asking your doctor about an RSV vaccine. Living in long-term care, RSV can be an unwelcome visitor, right? An RSV vaccine is serious protection from illness. Next slide, please. I think the next couple slides are just some examples. Oh, next slide, apologies. I didn't realize that was, but you could take a look. These are ads for healthcare navigators. Help someone you love get an RSV vaccine. RSV can spread in long-term care homes. RSV can make anyone 75 or older seriously ill. We're also geolocating these, the delivery of these ads by identifying people who are in and around the vicinity of long-term care facilities, making sure that people who are frequent visitors to these facilities are actually getting these ads, because chances are they either work there or are visiting a loved one there. Next slide, please. Thank you. And here's a look at our ads for healthcare providers. When you bring up, right, we're telling doctors, when you bring up RSV in a conversation, you can bring down its risks. And to healthcare providers around expectant moms shouldn't have to expect infant RSV risk too, right? So talk to your patients about RSV. And I think there's one more slide on this suite of ads. And this is directly for pregnant people. I love these ads. These are my favorite. RSV vaccines give your baby a leg up before they take their first steps. I think that is very sweet. I love that image of the baby shoes on the pregnant belly. It's wonderful. I want to make sure before we head to the next slide to say a little bit about the inputs, the various inputs that informed the creative development for these ads and the ads that you're going to see in a minute. We conducted both an exhaustive literature review as well as a secondary data analysis from our previous We Can Do This campaign, as well as, we looked at external other resources like CDC's National Immunization Survey as a key resource. We did a ton of consultations with subject matter experts, some heavy social listening and social media analysis. And we also did primary research with our campaign audiences. So we completed multiple rounds of ongoing tracking surveys. We have audience specific pulse surveys currently in the field to help us learn more about the demographics and attitudes and behaviors of our audiences so that we can fine tune and adjust our creative as needed. We've conducted in-depth interviews with among adults 65 plus and healthcare providers who work with older adults, including older adults in long-term care facilities. And we just launched a series of focus group discussions where we will learn more, where we learn and will continue to learn more about all campaign audiences. So, as was noted at the top end, that what makes us incredibly proud of this work is that this is data driven and evidence informed. Next slide, please. And these are some of our rapid response FAQ ads. What these are designed to do is just, as you can guess, FAQ, answer frequently asked questions, because we find that these FAQs, and we call the internet, and we also take questions from our other groups, that there's just a lot of misunderstanding, and in the year a year of there being no consistent nationwide messaging on vaccines like COVID, for example, there's just been some rampant misinformation. This is not a campaign designed to eradicate misinformation. That's a whole other effort and charge, but we do address head-on frequently asked questions. A number of key barriers to access or key barriers to a lack of motivation in terms of getting a vaccine have been associated with just a lack of understanding of the side effects. What can I expect? Can I co-administer, right? Can I get more than one vaccine? Will this hurt? What will it do to my child? So we are just directly responding to these questions, and through animated ads and also static social, addressing head on that there are rare but serious reactions, right? Things like allergic reactions, things like heart inflammation, but they are so rare, and that the benefits outweigh the risks of COVID-19, and that most people have mild or no side effects at all. And so they are still needed, right? Questions about can I get the flu if I were to get a flu vaccine? That question comes up all the time in our in-depth interviews. So these ads are designed in a way to address those head on, where the real estate of our other ads don't really allow for it. So you might see these on social and digital. Next slide, please. And next slide. And here's a look at just our the ads that are launching next week. I'm so excited. I actually should say that our TV ad is launching during the Emmys on Sunday. So if any of you are watching the Emmys this Sunday or planning to, be on the lookout for our TV ad for adults 60 plus and healthcare providers. It's called Big Little Stuff. That really encourages vulnerable groups to get the vaccine, because you need to enjoy more of the big little stuff, right? Like playing basketball in your front yard with your family, or blowing bubbles with your grandkids, or filming a TikTok video with your grandkids. So we're so excited to see that come out. And as some other examples, more catching up, less catch you next time, right? We don't want these viruses to rob us of our time with our loved ones. More, let's keep going, less go without me. More, I'll be there, less, where have you been, right? So I really get goosebumps when I see these ads, because I think they really capture where people are right now in this journey. There's a lot of fatigue, and there's also a lot of confusion about the importance of these vaccines when we're out of a public health emergency, the formal public health emergency phase. But the fact is, it is endemic. The fact is, we continue to lose 1,000 people a week to COVID. It is complicated. It is a growing risk factor. It is one of the leading causes of death, COVID specifically, among these vulnerable populations. But we don't want to turn people off via doom and gloom messaging. Our data really revealed that people want to be given hope and want to be motivated through hopeful messaging. So we're so excited for these. I think there's a few more too on the next set of slides. You can move on. This is, we have a TV ad that will be released called More Good Talks to our healthcare navigators. Really, the message there is get your older loved ones vaccinated so that you can have more good talks with them. Here's another look at some of our healthcare navigator ads. More time at the table, less time in a waiting room, more come on by, less today's not good, more dad jokes. We love dad jokes, fewer dad concerns. And as someone who was a healthcare navigator to a very ailing father, that I think these ads just really hit home. Next slide. And this is a look at the ads for our long-term care facility residents, more up for activities, less under the weather. And then speaking directly to healthcare providers who serve residents in long-term care, help stop a big time problem in long-term care. This is really important. One thing I'll add here so that I could skip this slide later on is that we're actually placing ads and signage in long-term care facilities in key markets across the country. And these posters will be speaking directly to patients and healthcare navigators. It looks like posters in elevators, posters in cafeterias, table tents in waiting room and cafeteria tables. We'll have 15-second and 30-second ads just on loop in closed circuit TV. We will have ads in facility newsletters. We will have ads in bus shelters in the vicinity of long-term care. And we will be geo-targeting people who work at these facilities to make sure that we deliver these messages directly to them to motivate them to have these conversations with the people under their charge. Next slide, please. You guys are getting a real sneak peek. We haven't shown these to anyone yet. These are ads for pregnant people. Don't let RSV steal a minute of your bonding time. You worry about a million things, make it only $999,999. And the number one cause of infant hospitalization is surprising. Don't let RSV surprise you. Next slide, please. And finally, I think this is it, our ads for healthcare providers, right? You can help keep infants from getting really sick. Let your moms to be know that their flu, COVID, and RSV vaccines protect their babies. And most adults say their doctor's opinion is their number one motivator. With your advice, they can protect themselves. And we love the diverse suite of folks that we've got in our ads. Next slide, please. And this is just just more of a sampling. We wanted to make sure that we showed a variety of abilities, right? And a variety of interests, playing cards or, hanging out with your grandkid, playing basketball with your friends, cooking with your loved ones. Really wanted to show all the facets of like the big little things in life that we love and that we don't want to take for granted, and that we want to help people protect themselves so that they can enjoy more of these moments in their lives. So this is it's really, really hopeful messaging. My favorite is eat for two, sleep for two, protect for two. Next slide, please. And then next slide, I think we could actually skip this one and go to the other one. This is really great. We're all big fans of AARP. They've been a key partner in so many ways for so many years. We're sponsoring AARP's Your 50 Plus Guide to Vaccines this year. It's a 2-page editorial disruptor informing adults 50 plus about when and why they should get specific vaccines. This will allow us to tap into their large audience. It's an audience that is proactive about health. It will be mailed to their full list of members. We're talking 21.5 million in circulation. So we're very excited about that. Next slide. Next slide. Just a little bit about our partnerships. We have a mix of paid and unpaid partners, as mentioned, at the national, local, and regional level. The ways in which they are supporting this campaign and we're supporting them are that they're sharing campaign materials on their website. They're featuring campaign subject matter experts. We have a roster of trusted messengers who are trained experts that we mobilize as spokespeople. And so our partners are featuring them on their blog posts, on their websites, on their podcasts. They're hosting webinars and panel discussions to promote the campaign, featuring principals from HHS or CDC. And they're integrating our paid ads like web banners and newsletter ads into their own media assets. So this is in addition to the in-person and pop-up clinic work that we do with them and the big sort of activations. Next slide, please. And we could actually skip this slide and the next one in the interest of time and go straight into campaign resources. And I thank you all for being so patient and gracious. I just want to make sure that you all know that when we launched the first set of Cultivate Confidence ads on August 19th, we launched our website, as mentioned. Our website has resources there's a selection of campaign ads for all audiences that you can download. There are also resources for healthcare providers and things like FAQs on COVID flu vaccines, fact sheets that providers can give to patients, a common concerns document that answers frequently asked questions about the 3 viruses, posters, digital banners, etc. And then it also has the website also has campaign ads for priority audiences and talking points for our agency partners as well. There's also social media messaging. There's static ads for web and marketing channels. So there's a ton of great resources that we encourage you to take a look at. On the sort of bottom right of that slide, I can make sure to share this out or put it in the chat if it's possible. There is a site that we set up for partners. People can log in, go in and access all of these resources. I'll make sure that this is shared out, but we are going to be sharing a new suite of resources next week. And in fact, I think that's on the final slide. I think that you can move on to the next slide. This shows just a quick look of our healthcare provider resources that are available on the website. Highly encourage you to check them out and share them with the appropriate groups. And then the final slide. So next week, we are launching our second wave. There will be new materials for partners on the website. It will include a range of new ads promoting flu, COVID, and RSV. This will include TV, print, static, animated ads for multiple platforms, as well as radio ads. And then you can send us a message through the contact the campaign feature if you want to have access to more of these assets. They're designed so that you can slap your logo on them if it's appropriate. We really wanted to do as much as we could so that our partners at the state and local level, health departments across the country can, rather than, spend their own money, they can just leverage this campaign and spread this message broadly with their communities. There will also be new social graphics and messages for partners to use across a number of platforms. And we will have talking points so that you can go out there and talk about the campaign and you'll be armed with the latest and greatest information. And then I think that is it. The next slide is just our lovely logo. I love this logo. It was a labor of love getting here, but thank you so much. And for having me, for allowing me this space. Always a pleasure to be here with you all.
Thank you very much, May. A very exciting set of tools and resources. A couple of thoughts. One is the flyers that you had that show healthcare provider faces might be nice to have an opportunity for in a provider office for you to put that provider's face, because we know that your personal physician making a recommendation is a powerful tool in getting somebody vaccinated. So that may be one.
I love that idea. Yes.
The other one is that, as we think about additional partners, I think about my life in my academic medical center and my role with NFID, what are specific actions that partners can do to help to reinforce this message and get it out beyond, not that you're not hitting a lot of places, but there are always going to be more opportunities to get this into areas that each individual is not going to think about every possible avenue.
Yeah. Yes, absolutely. That's a great question. Thank you. The quickest and easiest way is to get a hold of our ads, get a hold of our creative assets that are on the website. And as I mentioned, next week, we're going to roll out new ones for COVID and flu, right, for the new season, and share those widely on your owned media channels, on your website, if you've got a newsletter, if you've got an email listserv, if you've got social media channels, share those widely through the channels that you typically use to reach the people that you serve or work with, right, or protect in some way. And then another way is that we would be happy to come to you to deliver a presentation. We could, bring in subject matter experts from our partners over at CDC. We can bring in folks from HHS. So that's been really fruitful. In fact, following this, I have a learning lunch with the Coalition for Trust in Health and Science just to talk about this work. And people have really been taking advantage of that, or taking us up on the offer. We welcome the taking advantage of, is to get this information out there. And then finally, these talking points are critical. If you have principals that are out there, engaging with the press, engaging in any sort of a public way, arming them with those talking points is going to be really important to make sure that they're promoting the message of the campaign, talking about the work, pointing people to this U.S. government effort, right? This big effort to get as many vulnerable people vaccinated as possible. And then finally, we're also open to other ideas. So if there's an idea that we haven't mentioned, a way in which we can partner together to reach the people that you would like to reach, just let us know. We are absolutely always excited to have the conversation.
Great. Mitch Rotholz.
Thank you for the presentation and overview of the materials. It's exciting that we're going to have some public education messaging and a couple of observations and questions that came to mind as you were presenting, that if I get some insights, if you have them. One audience that I didn't hear you talk about that you were targeting are the payers. We know that they could be a barrier to access for the providers as well as the patients. And so are you doing any work on there to make sure that they're aware of your messaging, what you're telling the public, and that the system is prepared for when the patient comes to get vaccinated? So that's one first observation. Following up on Dr. Hopkins' comment about partners, a lot of your ads talk about the physicians, but we know in the physician's office there are multiple players who really influence the patient. And I think, coming to with a team-based message, not only within the medical practice, but also in the community, pharmacy teams, community health center teams, other people who influence individuals in the community. I didn't see any of those assets talked about in your material. And then I saw a lot on RSV, but I didn't see one of the things that providers struggle with is how do you have an effective conversation talking about all three of the respiratory vaccines. So I didn't see any messaging to the public on that. And so I'd be curious on any ideas you have there. And then specifically on the RSV, there's a lot of disease specific indications for individuals now based on the recommendation from CDC. Do you have any assets that help educate the public if you have one of these conditions? Instead of saying if you have a chronic condition, focusing more on some of those conditions.
Yes.
Thank you.
So thank you so much for these wonderful questions. First of all, I want to make sure you may have missed it because I went through it very quickly, so my apologies, but our ads that are launching next week and then the remainder of ads right throughout the fall and winter, they do speak to COVID, flu, and RSV. It's that secondary headline on the ads. And in fact, our TV ad that's launching, our total market ads, as well as our ads for Black, Latino, and rural audiences for TV and radio that are launching next week, all specifically mention COVID, flu, and RSV. It's just these suite of ads that are out right now that launched this month or last month focus on RSV as a sort of direct response to what we saw as significantly low level of awareness of RSV and of the vaccine because of how new it is to the market. But rest assured, they do speak to all three. And we encourage co-administration in our partnership activation. So, for example, we are speaking to the American Society of Consultant Pharmacists right now. We're more than speaking to, because I can share this. We are setting up to 30 pop-up clinics in key states inside long-term care facilities in partnerships in partnership with long-term care facility pharmacists, as well as outside pharmacy groups, if a long-term care facility does not have one, to administer both the flu and COVID vaccine on site to patients. So, very, very important there. We don't have ads specifically speaking to payers and pharmacy groups necessarily, but we are speaking to them, right? There's in the sense that there's a constant flow of information that's being shared with folks like CMS and other relevant groups, right? I'm speaking to pharmacy groups next week. I'm in touch with a number of major and independent retailers. So we, as much as possible, are keeping our stakeholder universe as wide as we can to anticipate for these sort of caveats, right? And these nuances, so that folks at the register, as well as the person administering the vaccine, is aware of what it is that we're trying to do here, and what the person, is like, what it is that's motivating them to be there. So we are, as much as possible, speaking to everyone. And if there's a group that you want to make sure that we are speaking to and we are coordinating with, we welcome it. And then the last thing, forgive me, I think I forgot your last question, your final question.
Oh, educating about the at-risk conditions versus just saying.
Yes, for RSV. Yes, and the chronic conditions, not just RSV, right? COVID as well, and flu. So our big sort of flashy TV ads will make mention of it, right? If you are 65 and older, and have a chronic condition, right, we'll make mention of it. But the real estate is limited, and we have to deliver a message that will captivate someone's attention and get them interested enough to visit vaccines.gov, which is our call to action site for the fall and winter. But we have thousands of assets on our website and through our partnerships that expand on this, right? We have, for example, a conversation guide that we are developing for healthcare providers that expands on this, and also provides, examples on how to facilitate a conversation around these nuances. Our social and digital ads is a little bit more real estate to name these specific things, right? Diabetes, heart condition, et cetera. So wherever there is real estate and an opportunity to clarify the nuances, we can, and we direct people to the latest and greatest sources of information, key websites. As much as possible, we try to capture all of this. But again, as this goes out into the world, and if any of you see that there's a missed opportunity, this is a team that values feedback. We alone are not going to be the ones to, get every single person who needs a vaccine vaccinated. This is just one piece of a larger effort. We're all here working towards the same goal. And so I consider all of you partners in this. I consider all of you Risk Less, Do More champions and ambassadors, because you are truly the embodiment of that. We're just the communicators and the ad people. So if there is an opportunity that you see as these assets go out into the world where we're missing, please let us know. We want to hear about it, because we have an ongoing monitoring and evaluation system that's set up in a way that allows us to course correct and adjust. So please consider this the beginning of a longer conversation. I'd love to keep this going.
Great, thank you. Our next question is from Daniel Hoft.
Thanks, Bob. Great presentation and very important campaign. My question is about the bundling of these three vaccines, and how during the pandemic we did have a resurgence or increase in vaccine hesitancy and more energy, at least among the anti-vaxxers. I'm just wondering if you have seen or anticipate any negative consequences from the COVID history on flu and RSV vaccinations, and if so, what are you doing to try to prevent that?
Yeah, that's a super good question. We did some heavy analysis and research at the start of this thing to understand where people are now in terms of their knowledge and beliefs and attitudes of these vaccines. And, and certainly identified some rampant, I wouldn't call it misinformation because for me, misinformation suggests something sort of like there's a malicious intent. It's just a lack of understanding and a lack of awareness. Things like, I can't have a flu and COVID vaccine at the same time, not understanding that you can get those vaccines at the same time. And the flu vaccine is designed to get me sick. Or I don't think I need the vaccine because I got the primary series back in 2021. And that's just a result of there having been a vacuum. And as mentioned before, a lack of consistent messaging. So we did anticipate as much as we possibly could, and try to directly hit on that through a rapid response FAQ ads that are designed to address that head on. And then we're doing a ton of state and local earned media tours. Right now, we've got one going on in Arkansas with a ton of trusted messengers who are also medical providers, physicians, clinicians, people that are working on the ground. Those opportunities are designed to really like drill down on that rampant misunderstanding and misinformation. And we start to see those interviews, right, being picked up across outlets, by outlets across the various regions that we're trying to hit. We also have it, our animated videos are designed to be explainer videos in a way, demystifying some of that, right? And just like pushing through the nonsense and clarifying what these vaccines are, what the very limited risks are, acknowledging and naming that, because we can't pretend that they don't exist, right? They do come up, but making it very clear that your risks are even higher of significantly more severe outcomes if you were to not get vaccinated, especially if you're older and have any conditions or chronic conditions. And so our animated videos have been tested and designed in a way to really demystify and deliver that clear information. And it's addressing misinformation without the user really being told, right, that you have the incorrect information. Here is what is right. Right. But what we are doing now, though, we have ongoing surveys that are in the field every week or 2 weeks that are specifically like assessing where people are in terms of their current knowledge and behavior and attitudes towards these vaccines. We're attempting to see if there is some sort of a link between our ads and any change across those metrics, but we are specifically looking at like, what is their basic understanding of these vaccines? How have they changed? And if we are picking up on some rampant misinformation, just some wildly inaccurate thinking, then our campaign is designed in a way that we can quickly address that through a number of ways. We can execute on some key partnership activities, right, that are really topical with important, formidable subject matter experts. We can deliver on specific social and digital ads or whatever ads that are the most effective in reaching the people who hold these beliefs. And then we can track and assess and see if there's been a change. So we're always accounting for the fact that misinformation is rampant. We also do a ton of social listening and analysis. It's all the time. We are looking at what people are saying online. What are people searching for, right? And then also correcting and responding through our website, right? Do we have to change the way we word things on our website and in our ads so that we can get those people that are searching for information and may have incorrect information, but are clearly really hungry for accuracy? Can we get them to our ads? Can we get them to our websites so that we can give them the information that they need? So it's a big mechanism. There's quite literally like tens of people on the research side and over 100 people on the creative side working on this. But we're certainly trying to address it. Yeah.
Right. We're running a bit over time, but we've got two more questions or comments. Next is from Steve Renderneck, who's online.
Oh, thank you much. I love this campaign. It's so nice to put all of these together under respiratory season instead of what has traditionally been just a flu vaccine season. two quick questions. Um, the RSV vaccine, both for maternal use and for older adults, is currently just a one lifetime dose. Do you think all those that received it last year will have some confusion when it comes to this campaign as far as getting into their doctor if they've already had the vaccine? I would imagine there are a lot of providers that are not aware that this is a one-time lifetime dose, at least as of now. That's question number one. Number two, there are some beautiful slides and images of maternal vaccination for RSV. Was there any consideration of including any information on the monoclonal antibody, Beyfortus, as well?
Yeah. Thank you for those questions. Just decline this team. Who is calling me on Teams at this very moment? The question about whether or not folks are aware that the lifetime dose for maternal use and adult use, that's actually really good. I want to take that back to our research team and understand how we are accounting for that. So thank you for raising that. The information on the monoclonal antibody, very, very good question. We are adding that to specific assets where appropriate. But the scope of this campaign is focused on adults. So we're not necessarily proactively developing assets around the monoclonal antibody, but in our sort of in our assets where we have larger real estate, like on our website, through our partnership materials, there's always an asterisk to say there's also this availability, and we point people to CDC. So because wherever possible, we definitely want to make sure folks are aware. But thank you for those two questions, and especially raising the lifetime dose question. I want to be able to circle back with you as well with an answer.
Got it. Thank you much.
Thank you.
And our last question or comments from Molly Howell.
Yes, thank you for the presentation. I was just wondering if there's an opportunity to share your market research with other organizations who are planning respiratory campaigns, state and local health departments, as that might inform what some of us may want to do in the future as well.
Yes, absolutely. We're actually pulling something together now for state and local health departments because it was raised in a conversation I had last week that it could be helpful as they have conversations with the powers that be around their fall and winter respiratory season education planning to make the case that here's the research that went into this effort, here's the data, here's the evidence. So absolutely. And I do encourage you to reach out to me so that I could make sure that I'm interfacing with you directly, but there will be some shared data and research with our partners, specifically our state and local health departments, in the coming weeks, this month, crossing fingers.
Well, thank you very much, May, for this
presentation.
You. And, you mentioned the Arkansas Media Tour. You and I need an offline conversation. WUPIG. All right.
Yes.
Thank you again.
Thank you so much. You take care.
All right, our next panel is Investing in Vaccine Equity Pays Off, two innovative projects. We'll hear from Sam Brown from Civic Heart and Christine Ashimwe from CHEC. In our next session, we'll hear about a couple of these two projects. Sam Brown at Civic Heart, which is an organization in Houston, Texas, that takes a holistic approach to providing programs and services for populations that experience the greatest disparities in social determinants of health. And CHEC is an organization in Arizona that responds to emerging needs and serves migrant and border communities with advocacy, research, and action. And then Sam and Christine will present these two projects. Sam, I see you on video. You have the floor.
Good morning. I'm Sam Brown from Civic Heart Community Services, located in Houston, Texas, and I'm here to speak about the PAVE program that we conducted over the last 2 years. So from 2022 to early 2024, we were conducting the PAVE program. We targeted Houstonians and also members of Waller County, the Waller County residents, to navigate them to vaccine equity. We wanted to make sure that people in the community were navigated to services, they were informed about the impacts of COVID and flu and how they impact the community together. We also provided education and we targeted gatekeepers, popular opinion leaders, and community advocates to really hone in that message, those messages of the importance of getting vaccinated for both COVID and flu. Next slide, please. So during our program, during our PAVE program, we ran into stigma and misinformation in the community that we really want to highlight here. In the community, we saw over the 2 years of the program, we saw that there were issues that changed throughout our implementation. At the very beginning of the program, we found that among Black and Brown communities, there was a barrier between the community and the medical providers. There was a distrust there. Impact their communities. It was like I said, it was a distrust in the community, and also there were issues with some people in the community learning from social media that they were immune to the COVID vaccine, which was something that we really wanted to make sure that we dispelled, and wanted to make sure that we spoke to that. In other areas, like in rural areas such as Waller County, we saw a very politicized view of the COVID vaccine. We saw that many of the residents felt that the Democrats were planning something behind the COVID vaccine, or the Republicans were doing it. So we worked with the community and with health providers, the Houston Health Department, local pharmacies, to ensure that we got that information, the correct information to the community. And also we were able to address those issues through education, through navigation to vaccines at health fairs and at different entities where we can work with the community. We also partner with community entities such as the United Way, Career and Recovery, the veterans serving agencies, to all work with the community and engage them at different areas, because we saw people in different ways. We also we used the vaccine learning hub provided by the PAVE program to formulate messages that could be used in our social media marketing as well as in outreach. Next slide, please. And the next one. Yes. So we use, like I said, the surveillance data from the city of Houston, and we paired that information with information that we received from the Vaccine Learning Hub to formulate messages. And we use those messages, and as we formulated those messages, we brought those messages to our CAB, our community advisory board, to make sure that they were linguistically and culturally appropriate to target to target the populations that we were serving. And we wanted to make sure that the messages were clear and that we clarified any misinformation that the general public had. We also understood that there was a disconnect between what was posted on social media through various entities and what people saw on the news. So we were able to get the facts from those entities and make sure the people we were serving really received the facts. We also worked with local pharmacies and also national chain pharmacies to provide incentive to individuals who did get the vaccine during outreach and during those scheduled times. We participated in pop-up vaccination sites, pop-up clinics, where we were then able to inform individuals about the vaccine, how the vaccine is transmitted, in ways that they can prevent the way that they can prevent receiving the virus, the COVID virus. We wanted to make sure that people understood that this was not a grouping thing. So early on where we saw where people were saying, hey, this group is responsible or that group is responsible, we eliminated that stigma through providing facts and information from those health authorities. And I would like to take our time to thank the CDC Foundation for all of their help with getting us facts and information through the Learning Hub that we were able to use. We were also able to connect with other agencies and entities throughout the United States to see what they were doing in their communities or what barriers that they had so that we could be proactive when we encountered those same issues in our area. And also, we want to take our time to thank the community leaders and the stakeholders that volunteered to get those messages out to their clusters and their social networks, making sure that those messages were really driven home because in different pockets you saw different attitudes towards COVID and flu and different attitudes towards the actual vaccine. Next slide, please. And if you have any questions or want to reach us or you want to follow up, this is where you can contact us. We had a great time with providing services for the community, with making sure that everyone had access to the vaccine, they had access to services, and also providing an outlet to hear so that we can hear their voices. When we were implementing our program, we wanted to make sure that we heard the community and we understood what their concerns were so that we were able to address them. Thank you.
Thank you very much, Sam. Our next presenter is Christina Shimway from CHEC.
Good morning. I'll be representing the Southeast Arizona Health Education Center, and I'm speaking on behalf of one of the programs, the Migrant Healthcare Program of CHEC, that received the CDC Foundation fund for promoting and making sure that all migrants get information on vaccines. Before I dive into what we do and how we do it, and specifically for this program that I had, I would like to give you a bit of a background on CHEC and how we came to come into existence, what we've done up until today, and some of the highlights of CHEC. Next slide, please. So the Southeast Arizona Health Education Center, CHEC, was established in 1985 to recruit, place, and retain culturally competent health professionals in Cochise, Pima, and Santa Cruz counties. And after 30 years, being funded by as a state and federal regional EHEC, CHEC now is a standalone nonprofit organization that's headquartered in Nogales, Arizona, with a mission to enhance health for rural, migrant, and border populations through advocacy, education, and action. Some of the key years that we'll see on the next slide. We were established in 1985. Next slide, please. As an IHEC, Area Health Education Center in Arizona. And in 1990, we received the first health education training. We were awarded as a federal health education training center. Then in 2000, and these are just the highlights. There are many years that could not be mentioned, but these are just the key highlights that led us to where we are today. In 2005, CHEC was awarded the Southern Arizona Border Health Career Opportunities Program. And in 2010, CHEC received a grant to launch the Arizona Border Communities Health Network. And 2019, as I like to consider it the most recent, we were awarded the Rural Health Program of the Year. And most recently, and which will bring me to the Migrant Healthcare Program, CHEC received the CDC Foundation Partnering for Health Equity fund or grant that we used to address vaccine hesitancy and promote vaccines among migrant populations here in Arizona. This grant, we are grateful to CDC Foundation because this grant has been renewed for another year until 2025. Next slide, please. This CHEC has a team of 10 dedicated full-time staff, and 80% of the staff are community health workers, trained community health workers that I'll speak more in details in the coming slides. And all of us at CHEC either bilingual or multilingual to be able to accommodate the populations that we receive and serve. We also have about 60 volunteers specifically attached to the migrant healthcare program, healthcare coordination program, which is based in the Pima County. And another big program, which is the NIH program, is based at the southern border, the Mexican Arizona border, which is in Nogales, and that's where our head office is. Next slide, please. And where does CHEC work? So we started with three, in 1985, as I mentioned earlier, we started in 3 counties, and we've expanded in 5 counties in Arizona. So the Cochise County, the Santa Cruz County, where our head office is, the Graham County, Greenlee County, and Pima County, where the program I head is based. Next slide, please. These are our programs. So 4 of the programs are based in Nogales, and the CHAMPS program, which is the CHEC Migrant Healthcare Coordination Program, is based in Pima County, and our offices are within a shelter, a migrant shelter, currently called the Pima County Respite Shelter, where migrants who come through the border and are coming through either from detention or directly from Border Patrol receive services before they can continue their journey. And some of these services, they receive medical and healthcare promotion services, as well as care coordination for those who have chronic conditions. And the program, the Migrant Healthcare Coordination Program, right now working with the CDC Foundation grant that we received for vaccine equity, as well as Pima County, the FEMA Fund works hard to ensure that migrants who enter into the United States get the vaccines they need, as well as all the other healthcare coordination and services they need. Next slide, please. In the following slides, I'll be focusing on how healthcare coordination, migrant healthcare coordination is done at CHEC through the migrant trained community health workers, bilingual and both culturally and linguistically trained, which at the beginning of CHEC as an area health education center was the objective to put together young people who trained and willing to go into the communities and take services to the people in need. Some of the volunteers I mentioned, 60 of the volunteers I mentioned attached to the program are also community health workers, but 15 out of the 60 are full-time volunteer providers who treat the sick, and others are students at the University of Arizona, the Pima Community College, and as well as different universities in Arizona that give us students. Next slide, please. So the Migrant Healthcare Program connects migrants who need health services, both here in Tucson, as well as the Pima County, and in their destination communities throughout the United States. So this is done through the community health workers, as I mentioned, and they work tirelessly to reduce vaccine hesitancy, because migrants who enter the United States don't have an idea about why they need vaccines or the timelines for those vaccines. So it's the role of the community health workers to educate them and bring the services to them through providing them with health education materials while they're still in the shelter, including information on COVID, the flu vaccines, as well as all the other vaccine information that we receive from the CDC. Actually, before I hopped onto this call, I received one on folic acid. So we received this kind of information, and we able to translate or interpret into the languages that the people we have in the shelters speak, and we are able to educate them on that. We also, community health workers, the team of community health workers that we have also coordinates logistics for follow-up at the final destinations. We provide lists of partner agencies or local health departments, vaccine centers, and services for migrants. We go beyond that, and we also look into food banks. So basically everything that is social determinants of health, how we can ensure that when they get in the communities, they don't bring disease or even deteriorate within the communities. We also support migrants with information on low cost and affordable, as well as linguistically appropriate resources in their destination communities. And we host and attend health promotion events, health fairs, and awareness campaigns in schools, in consulates, and the most recent one being starting to go into the community, the communities with our partners, health centers that that are willing to have us host our services there, so we can speak to migrants, so they can know as soon as they get in their final destinations that it's okay to seek services where they can, because there is the fear of I will be deported if I seek services, or if I go for a vaccine, what will happen? So we educate them about the free vaccines that are available and where they can get them from. Next slide, please. So the Migrant Healthcare Coordination Program in the shelter has care coordination, provides care coordination. Specifically when we have the sick, we send out referrals to hospitals and other clinics that we work with. Once they are discharged from those clinics, or once we've received them from detention, Border Patrol drops them off and they are really sick, then we ensure that they are treated, and we connect them with healthcare services and facilities at their final destinations and destination communities. The team of community health workers here in Arizona also follows up with other area health education centers in other places like New York. We currently have a partnership with the HHC in New York that serves the BQLI, the Brooklyn, Queens, and Long Island areas for all the migrants that leave Arizona and go there. In prior years, we had also partnerships with Miami and Texas, and we are in the process of resuming those partnerships. Other services that we offer at the shelter are provider consults, prescription refills, because their prescriptions are confiscated alongside other materials that are confiscated during detention, meals for those who need, who are diabetic and need special meals, over-the-counter medications for those who have been deemed to need them. And we also offer health education. And this is specifically where our community health workers' role is crucial for improving vaccine hesitancy. Next slide, please. These are the countries of origin, and the bigger chunk of population that we receive is from South America, Mexico, Venezuela, Guatemala, El Salvador. We've also recently, just of recent months, we've started to see a large population from India, Asia, mostly India, China, and Africa. Part of the populations that we are seeing, as you'll see on the slides to come, do not speak English and do not speak Spanish, which are the main languages that are spoken at the border. So we've integrated health education in various other languages that these migrants who come through the border speak, so we can be able to serve them. Next slide, please. These are the symptoms that we see and the conditions that we see and treat as soon as we receive them in the shelter. So colds, stomach problems, rash, wounds, tooth pains, as well as medication refills for chronic conditions. The most rampant one being asthma medication for children, as well as some communicable diseases which need isolation, like varicella and scabies, that we work with the Pima County Health Department to isolate them until they are fit to go back into the community. Next slide, please. As I come back to this slide, I wanted to focus on how CHEC and CHEC's community health workers focus the effort on educating migrants through the funding that we receive from CDCF. CHEC educates and empowers community health workers. So we are consistently recruiting and training community health workers on vaccine safety and cultural competence, as well as effective communication. We provide resources, mentorship, and community engagement through the AZCHOW, which is the Arizona Community Health Workers Association, to build trust and support vaccine promotion efforts. We get resources from CDC and other partners to be able to do that. Then community health workers who are fully trained collaborate with local health providers to ensure the vaccine services are accessible and they meet safety standards. We distribute educational materials to inform families about safety and effectiveness and translate them into the languages they speak in order to promote trust. Ensure that migrants who leave the shelter and seek other services are able to access vaccine services without financial barriers, focusing on equity and inclusion. And we develop unique communication and health education materials, brochures, flyers, WhatsApp groups. We keep all the numbers of the migrants that leave the shelter who need services, medical services, specifically pregnant women, children, newborns, the chronically ill and very critically ill, in languages, specifically languages that they speak and understand. And we have a group of community health workers who communicate with them on WhatsApp and keep in touch with them to ensure that they have sought services in their destination communities, and they have follow-up providers, and they're able to ensure continuity of care. Next slide, please. How do we treat the sick and how do we educate the masses and the migrants who enter the shelter? So CHEC is committed to prioritizing safety, vaccine safety for all migrants, families, and children. Before, the focus was on COVID-19, but now we are focusing generally on all adults and children to ensure that everyone is able to get access to vaccines. CHEC expanded the efforts in 2022 after receiving the grant in 2021, formalizing the migrant healthcare program, and has since served over 60,000 migrants. And this number doesn't include the the August numbers, sorry, because we were still finalizing those numbers. The CHWs under the CHAMPS program has interacted with 15,000 migrants, over 15,000 migrants that they meet face-to-face and educate them on the importance of vaccines. Next slide, please. These are some of the outreach events that we organize, and the events go into the 5 counties that they take place in the 5 counties that I mentioned earlier. And the team organizes to meet with mostly back to school events where parents come to bring children to get vaccinated or get all the other resources they need. And at these events, we issue health education materials and answer any questions they have, especially the new migrants. Next slide, please. Just to show you a little bit of how the CHEC Migrant Healthcare Coordination Program works at the shelter, as I mentioned in the previous slide, just offering basic care to ensure safe travels to destinations, health education, as well as follow-up in destination communities. So those are some of the pictorials of our providers, our volunteers, students, ready to serve the migrants. So those are some of the pictures of the clinic. Next slide, please. Some of the referrals and services that we offer to migrants who leave the shelter, clinics, lawyers, food banks, diaper banks, health departments, and where to get vaccine services, information on schools, and all clothing, all the services they need to promote their health as they leave the shelter. Next slide, please. As I mentioned earlier, we offer health education on vaccines and vaccine promotion in different languages. And some of the languages that we see in the shelter highlighted on this slide are also Spanish, French, English, rarely, Portuguese, Arabic, Haitian, Creole, Wolof. So one of the pictures on this slide is a guest that we received from Senegal who was reading. As soon as we handed him the health materials, he just sat down and started reading his materials in Wolof and some of the other languages from Asia. And next slide, please. These are some of the health education materials on WIC program, on schools, on vaccination, the flu vaccine. So in different languages, English, Spanish, Portuguese. We have materials translated in different languages, and our health education room is branded for migrants to be able to enter in and find their materials based on the country they are from. Next slide, please. Again, on COVID-19 and the information needed for vaccines and what should be done, what can be done to prevent the vaccination boosters needed, because we see migrants come and say, I already had COVID vaccines back home, why do I need another one? So we have to educate them as to how this has improved. So some of the posters, some of the materials we use are in this slide. Next slide, please. And coming to an end. So these are the successes. We've seen an increased coverage and trust from the community and understanding of vaccine hesitancy. Why do people hesitate to take on vaccinations? As well as we were able to tailor education to all age groups. And we've expanded our networks to serve other counties and other communities. Next slide, please. These are the challenges we still face. There is a language barrier. As we continue to expand, we continue to see new migrants from different populations and different countries come in with languages that we do not have the capacity to be able to serve, misinformation on vaccines, and generally on the health systems being different here in the United States compared to the countries where they're from, the cultural beliefs about vaccines, which are rooted in, not having the misinformation again on vaccines, and being able to work with foreign populations with different status, different knowledge, and different backgrounds, as well as multiple locations and dynamics of our locations, where we have different shelters and people being in different places, or families being separated, some of the family members still being in detention while others are in the shelter. So that kind of causes a challenge in terms of educating them at different times and then having to repeat ourselves. But as a team, as community health workers, we are dedicated to serving the community, and especially the people that come into this country, that we would like to give medical services and healthcare services so they can be able to start their lives in good standing. Thank you. The next slide has my contact information. In case you have any questions, feel free to reach out. Thank you.
Very much, Sam and Christine. Are there any questions or comments here in the room or from our participants online? Jewel, please.
So thank you for the presentations. I don't have a question, just an affirmation. I appreciate both of you. I just happen to work in Texas, and I just happen to have taken a group to visit a shelter for care of people coming across the border in El Paso a couple of months ago. So thank you for all you do. And I thought I would share something that I took a picture of from a slide that we could all hear, because I think that the presentation we just heard from CHEC models something that was on a slide, and framework for achieving equitable access to essential health care. And given what the topic of this session was, it seemed appropriate. And one of the points was to guarantee continuity of care across borders and sustainability. And it's clear that that's what both of you are working towards. So I just, again, wanted to thank you for your presentations.
Thank you.
Well, I don't see any other questions or comments either in the room or online. We want to thank you very much for your presentations. And at this point, we have reached the end of our morning session for this first day of our September NVAC meeting. We will now adjourn until 1 o'clock Eastern time. We will come back for our next session, which will be immunization equity lessons and evaluation approaches. Thank you to all who are in the room and online for joining us for our September NVAC meeting, and we'll see you this afternoon.
Produced by the U.S. Department of Health and Human Services.